Well, this one seems to be very, very interesting as FG now going to build a medical center in Buhari's hometown, few months to the end of his tenure. Well, when completed, the hospital will rank Katsina the only state in Nigeria with 2 federal medical centers, while 15 other states are without such a hospital. Thank you very much for joining us. It's a serious matters on ONIF TV. My name is Olukunle Abraham. Please do share our videos with others. Drop your comments, but then make them simple and civil. Well, the administration of President Muhammadu Buhari has budgeted 500 million naira for the establishment of the new federal medical center in Douara, Katsina State, Mr. Buhari's hometown. This is contained in the 20.5 trillion 2023 budget proposal presented to the National Assembly by the President earlier in October. When completed, the hospital will rank Katsina as the only state in Nigeria with 2 federal medical centers. The Federal Medical Center Katsina is one of the existing 22 federal medical centers distributed across the states of the Federation and Abuja, the National Federal Capital Territory, even though none of them is capable of taking care of our politicians and our president himself. Now, the distance between Douara and Katsina is 83.6 kilometers, and it takes about 1 hour to travel between the 2 towns by road. While Katsina is built to have 2 FMCs, there are 15 other states of the Federation that are currently without such a medical center. But the government has kept mute on the matter, describing it as a policy decision. Well, according to the Federal Ministry of Health, based on the 6 geopolitical zones, 4 states of Ogun, Lagos, Ekiti, and Ondo in the southwest region have a medical or federal medical center, while only Delta and Bayelsa in the south-south region have 1 each. Like the south-south region, only 2 states of Imo and Abia in the southeast have the presence of FMCs, while in the northeast, 5 states of Bauchi, Gombe, Taraba, Yobe, and Adamawa have a center each. In the northern central region of the country, Niger, Kogi, Benue, and the FCT have 1 each, and in the northwest, 4 states of Kebbi, Jigawa, Zamfara, and Katsina also have 1 center each. But this may change soon if the new proposal by the president is accepted and another FMC is completed in Mr. Buhari's hometown of Douara in Katsina State. Well, the states without FMC include Oyo and Osun in southwest, Akwa Ibom, River, Edo, Cross River in south-south, Anambra, Ebonyi, Enugu in southeast, Kano, Kaduna, Sokoto in northwest, Plateau and Kwara in north central, and Borno in the northeast. Plans for the FMC Douara is in top gear, as findings by the Premium Times, credit to them, have revealed that Governor Aminu Masari-led administration in the state has declared support for the establishment of the new federal medical center. The governor has approved that an existing general hospital in the president's hometown be upgraded by the federal government to the new FMC. And in addition, the governor announced the donation of 50 hectares of land for the project. The government has since directed the Katsina State Government Ministry of Health to liaise with the Ministry of Lands and Survey to commence the demarcation of the land in Douara, as well as the process of issuing the certificate of occupancy to the Federal Ministry of Health. More than FMC. Since Mr. Buhari assumed office as the president of Nigeria in 2015, his hometown of Douara has been regarded by many Nigerians as a construction site, following the growing and an unprecedented number of capital projects located in the town. In August 2019, the Nigerian government inaugurated the Nigeria Air Force Reference Hospital in the town. Of course, the Yorubas have a saying that if you give somebody a hoe, of course, when you're using a hoe, you use it to pull the sand to yourself, you heap to yourself using a hoe. So I think that is exactly what has just happened. Well, according to Daily Trust, credit to them, the hospital has equipment for radio diagnosis, cancer screening, dialysis, laboratory diagnosis, and research, and the president was quoted to have said the hospital would minimize the need for people to travel to other states and even abroad for health reasons. Well, I think if he had done this during his first tenure and he still needed to travel abroad, then this statement would have been against him. But I believe that by the time they will be finishing this project, he will be out of office by then. And so even if he has to travel out of the country for medical purposes, there won't be anybody, throwing words at him. Well, similarly, in November same year, the Women and Children Hospital Douara was established in the town by a philanthropist. The efforts the donor was quoted to have said would reduce maternal and infant mortality. The project manager, Mansour Kofi, during the signing of the Memorandum of Understanding on the health facility, stated that the hospital was to be built by Bellamar Oil Producing Limited based on the demand of the people of Douara, who were asked to name a particular project to be cited in their area. Well, there are other projects, including the Transport University and other such as electrification and provision of solar system and rehabilitation of the Kongolam Douara Kano Road. In fact, more than 13 ongoing projects in the president's hometown have been allocated more than 200 million naira in the 2023 budget proposal. They include the establishment of a booster station, the establishment of the Bio Resources Center, the fabrication of prototype machinery for the production of jute bags and allied products, and the development of an industry tannery, among others. The president has consistently emphasized his plan to retire to his home after completing his tenure in 2023 to take charge of his abandoned farm. Therefore, the turnaround of his hometown may not be unconnected with the retirement plan, of course, to make it of course, be the kind of enjoyment that he's having now, the kind of presence and attention that he's having now. He will want to have the same, at least something close when he gets out of office. Well, this is Serious Matters on ONIF TV, and that is it. As touching the establishment of another FMC in Katsina State, months to the termination of the tenure of the president. Well, drop your comment and please make them simple and civil. Thank you very much for watching. My name is Olukunle Abraham. God bless you. Bye-bye.